Hello, bonjour and ahoy. I'm Roger Hilton, Defense and Security Research Fellow at GLOBSEC, coming to you live from the 2021 GLOBSEC Bratislava Forum. It's day one, and it's my pleasure in the future for the next 3 days to be bringing you video highlights, recaps, and all of the major updates from our international conference. We have a rockstar lineup of speakers and moderators, and we really hope you look forward to watching us in the future. We started bright and early with our annual European Defense Roundtable and launched GLOBSEC's Future Security and Defense Council. Following the official welcome presented by our Masters of Ceremony, we heard a keynote from Slovakian President Zuzana Čaputová on Building Back Better. We were then privileged to hear a video message from His Holiness, Pope Francis, who spoke to our world audience on the merits of hard work and compassion. Staying in Central and Eastern Europe, both the President of Poland and Croatia delivered keynotes and stressed the need for global solidarity in times of crisis. Shifting to a topic of the future, an energetic debate on the state of the future of transatlantic relations in the digital sphere took place. While on our second stage, the global perspectives on how to fight COVID and emerge from the pandemic stronger also happened. Finally, to wrap up the day, the Prime Ministers of Austria and Slovakia, as well as the Deputy Prime Minister of Czechia, discussed the European Recovery Plan and how to jumpstart the continental economy. For more information on our other world-class panels, make sure to check our website and our various social media channels on Facebook and Instagram. See you on day 2.
Ladies and gentlemen, welcome the moderator of the first session of day 2, Sarah Wheaton.
Good morning, everybody. Thank you for joining us bright and early for this panel on redesigning healthcare systems in the wake of COVID-19. And before we get started with our panel, I would like to introduce His Excellency Vladimír Lengvarský. He's the Health Minister of Slovakia. Please. Nice to meet you. Please take the podium.
Ladies and gentlemen, distinguished guests, it's a great honor for me to be here on this great GLOBSEC forum. And I'm pleased to address you today with the remarks on the lessons learned and the way forward, especially in terms of reshaping the healthcare system. It is doubtless that the resilience of the health system has been strongly challenged by the outset of the pandemic. However, a concise approach to health policy enables us to bounce back and regain lost grounds. The health emergency has also caused that the health architecture has been put in the spotlight with the adamant call of its readjustment. First of all, the pandemic has shown that we have to review the approach to preparedness and strengthen the precautionary measures by taking into account two key factors: the adaptive ability of health system and the importance of considering the socio-economic challenges. From this perspective, the social determinants of the health will shape a major impact on the ability to reduce health inquiries. Secondly, this pandemic has widely exposed to the mental health related matters, so that further investments in the strategies centered at mental health improvement and preventive measures will be crucial in eliminating the social pathologies derived from isolation and lack of social interaction. Thirdly, it is indispensable to look further towards data harmonization so that reporting is performed in a unified way and the equal indicators are being reported at international level. The importance of having an accurate data is critical in the moment of making responsible decisions. In order to reach the correspondent and prevent the potential third wave from bringing another standstill, we have to implement technologies which have brought considerable results, such as waste border testing for revealing the concentrated incidence of the coronavirus infection, as well as sharing the best practice and fostering expert exchanges. Alongside facing new variants, increased sequencing capacities are inevitable also with regard to travel-related summer season. Speaking about the collective immunity, the key role has to be attributed to targeted vaccination campaign for the purpose of raising awareness, minimizing the vaccine hesitancy, and even tackling the misinformation. On a broader scale and from the strategic point of view, the hospital network optimization is another important step which will largely contribute to healthcare performance improvement. Moreover, it is designed in a way that it will bring about not only the high quality, but also accessible healthcare for the patients on the side of dignified working conditions for the healthcare professionals on the other. Apart from that, it will also reinforce the long-term and aftercare as well as provide better conditions for the patients suffering from the chronic diseases. Lastly, in light of today's interconnected world, the effort of tackle efficiently the present health emergency have to orchestrate it globally in the close cooperation with the World Health Organization, which stands as a strategic health pillar with mandated governance, and the European Union as the cornerstone of partnership and trust. Because the only road to the future is the road taken together. Thank you for your attention.
Thank you so much, Mr. Health Minister, for joining us. We know that you have a very busy schedule, so we will forgive you if you can't stay for the panel. All right, and without further ado, on with the panel. So joining us online, we have two participants, Francesca Colombo. She is the head of the health division at the OECD. We have Johanna Hannefeld, who is joining us from Berlin, and she is the head of international health protection at the Robert Koch Institute in Germany. Here with me, I have Martin Smetana. He's the Associate Fellow for Economic Growth and Sustainability Program here at GLOBSEC. And Gabriele Grom is Public Policy Lead for the Mid-Europe region at MSD. So thanks to all of you. Thanks to all of you for being here in person. Thanks to those of you who are watching online. I like to keep things interactive, so you have several different ways to engage and ask questions. For those of you who are in the room, you can raise your hand, and once I give you the floor, you can go up to the microphone here. You can also use the GLOBSEC app, which has a way to type your questions using Slido. If any of you are connected via Zoom to the virtual studio, that's also a way to ask a question. So actually, let's kick things off with a poll to help you, get warmed up with Slido. So just to kind of set the stage, we have a poll about where I want to hear your view about what will be the most important, urgent challenge for healthcare systems over the next 3 years. So in this kind of post-COVID recovery period. So COVID-induced backlog of chronic disease management, antimicrobial resistance, mental health, long-term care, and preparing for the next pandemic. So let me know what's most urgent in your view, and we'll check back in with the results later. And Francesca, if I could actually go ahead and start with you on that long-term care point. I know that the OECD recently did a study, a huge survey of European, not European citizens, people around the OECD countries, and long-term care emerged as kind of a pretty big concern, no?
Sure, absolutely. And I think the pre-existing weaknesses in the aged care sector and the long-term care sector have been brought to the fore really by the pandemic, because let's remember that those who suffer the most in terms of deaths, but also in terms of the most serious conditions are the people who are elderly, the people with pre-existing conditions, with the people with health issues. And unfortunately, the sector, the aged care sector, was already prior to the pandemic characterized by some structural weaknesses in terms of quality assurance mechanism, in terms of availability of enough and also trained health professionals and workforce, in terms also of infection control systems. So I think the pandemic, and that's the case for the elderly care sector, the long-term care sector that you mentioned, but it's probably more of a broader point. The pandemic has revealed some pre-existing weaknesses of our health system and brought to the fore the need really to address and improve the way health system work for the future.
Thanks. And Gabriella, as far as managing these chronic conditions, what should we be thinking about as people kind of emerge, maybe feel safe going to a doctor without a mask on, that sort of thing?
Yeah, so I think first of all, I see that there is a lot of impact on the crisis from the pandemic in a negative way, and we need to restart therapy. So we have seen that, for example, the number of diagnoses in cancer went down by 40%, which puts a huge backlog in place when we think about patients which are not taken care of, patients which, especially in oncological conditions, come too late potentially for their treatment or for a kind of a good kind of course of the disease curement. So I think we now are in a situation that we need to restart things as fast as possible. And that goes for chronic patients as well as also for patients with acute diseases. On the other hand, I see also that it's a huge opportunity to think about our prevention goals and how much we think about prevention, how much we think about immunization overall under normal conditions. So now we have to clean up all what the pandemic caused, but at the same time, we need to look into what were the areas which came out now that have not been so strong in our healthcare systems. And this is not only treatment, but it's also prevention. So it's both angles which we need to be very clear on.
Mm-hmm. And Martin, you've been taking a close look at some of the lessons that we can already learn, and you've seen some things. You've learned some things already about kind of the importance of prevention and having kind of a good baseline of healthcare, right?
Yes, so at GLOBSEC, we've been working on a paper which summarizes lessons learned. And one of them, and just to continue Gabriella's ideas, was that when we look into the most successful countries, we figure out that in most cases they have several traits in common, and one of them was that they really ramped up their diagnostic capacities, right? So just they expanded in terms of the number of tests done, they made it affordable, accessible, and well, all you need to do is just to replace COVID with breast cancer or prostate cancer, because it is virtually the same. The successful management depends if you can catch the disease at early stage, which is linked to the diagnostics, and secondly, and this is one of the very few positives of COVID, is that it illustrated that heavy investment will repay in time. The only difference between COVID and civilization diseases is actually that COVID fast-forwarded the relationship between a risk factor diagnostics and actually a result, which is the hospitalization and a death. So COVID showed us that it can work, and it actually brings return on money, which is in most cases the reasons why payers or ministries refuse to invest, because all they see is that I will do and pay 50 tests and I will find just one positive. But COVID demonstrated clearly that it is worth it. All we need to do is just to make it accessible, affordable, and well, let's say strategically placed within the health system.
And do you have a clear sense of where Europe is as far as advancing their diagnostic capacity, and are things equally kind of in an equal situation, or are we seeing east-west divides, north-south? What's going on there?
Well, unfortunately, this is not something that will be unified, even though there are some attempts. And this is another of large lessons learned. I really strongly believe, and there is a strong opinion that EU Commission should have, let's say, greater word in health policies and health management of health system, and which is rather funny coming from me because I was a member of Social Protection Committee on behalf of Slovakia for 5 years, and I was one of the guys who really struggled to make sure that EU Commission does not have a strong word. But the pandemic showed us that we need a unified approach rather than some disconnected strategies, including diagnostics, because I think that ministries and prime ministers need to hear from the top that this is a priority, this works, and you need to find funding. Because exactly as you said, there is a great disconnection between what type of tests are available, what age groups can get the test, starting with genetics and genomics, ending with all CTs and MRIs you can imagine. So unfortunately, there is a great variance, and this needs to be tackled.
Mm-hmm. Well, I want to put a bookmark in that idea of a health union. But Gabriela definitely had some thoughts on the equality
I had
question.
a thought, and I really wanted to contribute with this, because what we did, we have collected some data, and the data is about how long it takes for a patient from the first time when you see the first symptoms, for example, if you have lung cancer, if you start to cough and so on, to the time when you really get the treatment you need. And we have screened it across Europe, and we see that especially in Central Eastern Europe, we see long times until from the moment the patient presents for the first time, for example, at a GP, until he or she gets the treatment she needs. It can take up to 300 days. And if you think about especially cancer, time is really everything. If you have delays in your diagnosis, if you have delays in your next referral that you need to go to another center because you're not sitting at the same at the right place, if your GP doesn't really understand what needs to be done next and is delaying the process, this can be actually the death sentence for the patients. And that's exactly why we need to speed up and accelerate and create clarity in all this patient journey, including testing, including the proper diagnosis at the right time. And this is where we also create really the value for the patient by the end of the day.
And do we have a sense of, I mean, do we just need to throw more money in? Is there some sort of health system reform or?
I think there is reform needed. It's also money needed. So it starts with creating clarity on standards, clarity for the patient, clarity in the pathway the patient has to go, but also a lot of education on the side of the medical community, but also on the side of patients, to really help to get through this process. Currently in many countries, it's a jungle, and the patient goes back and forward. And if there is a certain kind of test needed, it takes 3 weeks to get the result. Then it comes out that there is another test needed because potentially the specimen is not enough, and so on. So and all of that needs to be streamlined according to, let's say, best medical practice.
Mm-hmm. Francesca, what broad trends are you seeing as far as health system investment? And is there any particular system that maybe is getting the best bang for the buck? Maybe they don't actually spend the most per person, but they have very good health outcomes.
Very difficult to say, because actually across all health system in OECD countries around the world, there are areas in which perhaps there are excellence, but also in the same health system you will find a lot of inefficiencies and waste that happens. And so it's very difficult to say which countries get it best. Certainly, I think there are some messages that come out from the crisis. The first one, it has been mentioned, yes, we do need to invest more in health systems. And it's quite clear there are some critical areas of underinvestment. Prevention that was mentioned, if we look across countries, it's only 3% of total health budgets which are actually devoted to prevention. So quite clearly, we're not creating that resilience in populations by addressing underlying risk factors, by addressing some of the broader social determinants of health, as was mentioned by the minister as well, that will allow us to be much better prepared to deal both with an infectious disease and with long and disabling chronic conditions. So that's one thing. We do need to invest more. We need to invest more in prevention. We need to invest more in better data systems. It's unbelievable how health are still stuck in in the previous century in terms of the digital transformations, in terms of using data to understand the pathway of care of an individual, in terms of linking data sets across different parts of the health system for improving not just quality, but also the governance of the system, the research, the empowerment and the people-centeredness and so forth. So huge opportunities from data, but we're not using it. And all of that does require additional investments. At the same time, we probably need to do things differently. We need to make sure that where there are instances in which we have spending that does not deliver any value, we address that. Medical errors, which in many cases can be prevented, can be addressed, and those are not creating any value for a health system, of course. So we can redirect resources rather than addressing a medical error to really making sure they improve outcomes and value. And we need to think also a health system which much more fluid, with a strong, clearly primary healthcare, is like from prevention, people are taking care early on in their journey, and making sure that there is a smooth also functioning of the health system across different parts and different silos. So there is both these needs of investing more, but also addressing some of the clear weaknesses which pre-existed, as I mentioned, the COVID-19 crisis, but the crisis has made it even more prominent. Obviously, there is quite a lot that needs to be done to make sure that we're ready also for an infectious disease and the pandemic of the scale and proportion of what we have seen, and that requires all sorts of things to be done at global level as well as the national level.
Thank you. And Johanna, I think we have your connection working well at this point.
Yes, I think we do.
Excellent, yeah. Excellent. Let's pick up on one of the points that that Francesca just made about digitalization, and I know that even before the pandemic, that was kind of a big mission of the German health system. So how is that going, and has it been sped along by the pandemic, or is it still kind of going at the same pace?
No, I do think we have seen a lot of innovation during the pandemic. And in some sense, this has been a window of opportunity, I think, to innovate at a pace that would not otherwise have been possible. So I think we have seen digital solutions. We've seen the use of contact tracing apps, for example, but we've also seen some work around telemedicine in lower income settings. So the Center for International Health Protection that I lead will be able to support that, and that's really helped bringing some of the clinical skills to countries where there was less experience and expertise, so really sharing as the waves of the pandemic transform. But for me, I think that speaks to a broader lesson from this pandemic. In many ways, I think health systems people, what we have seen is that some of the systems we would have classified previously as high performing did indeed not do so, whereas others were able to do that. And I think what that really has shown is that for systems to be resilient and to respond to a crisis or shock, they need to be able not just to respond, but really to adapt, and to transform in that response. And I think it's that transformative capacity that we need to invest in going forward. So that includes the prevention that we've heard about. That includes the strong emphasis on determinants that we've also that was also already mentioned. But I think it's also been about creating space to innovate for healthcare workers. And I think there are examples from individual health facilities all the way up through the health system that have really shown that this innovation capacity is quite essential, and that there we need leadership and we need governance structures that enable that.
So yeah, we hear this idea of health transformation a lot, and I've been covering health policy actually at the EU level for a long time, and I still don't always totally have an idea of what that means. Johanna just gave us some examples of her conception of it. Gabriella, what does health system transformation mean to you? To get a little philosophical first thing in the morning.
So health system transformation. So that's really about creating resilience in health system, creating the flexibility, which we just heard about. But I think also innovation is a very important point here. And it is innovation when it comes to applying new technologies. It is innovation into do maybe things differently. Also data and analytics will play a major role in the future. And I think there's a huge potential to create efficiency in the systems and to create also better outcome for patients. But I think also what we need to consider is innovation need to be accessible to patients. And that's one of the other issues which we see in some of the current systems, that there is too long wait time until patients can actually access and benefit from new innovations, from new technologies, after they have been brought to approval, to actually even in the European level. We see that so far access is not, let's say, equal across EU. And so it would be, of course, a desire to create equal opportunities in kind of benefiting from new innovation, from new technology to all patients across Europe. And we see, unfortunately, also here more on the Eastern European end, that there are serious delays until when patients, or as of when patients can actually access and benefit from these innovations, and there is a huge discrepancy versus Western Europe. At the same time, and I'm talking again with on the example of oncology, we see the highest mortality, especially in countries where new technologies take longer to get to be readily available to patients. So there is a very clear connection between outcome and innovation, so to say.
Well, and so I always, if there's somebody who works in the pharmaceutical industry, I have to ask them, is this lack of access because prices are too high?
No, I don't think so. No, I think there is today a kind of an ability to actually discuss on specific kind of agreements, and we are doing this as a company, depending really on the need of the country. So it's really target made, and we have many examples where we had been able to manage with many governments and all across Europe in different also economic conditions to make products available. And so very often we see a lot of bureaucracy is in the way, a lot of very heavy, bulky processes, which doesn't make it easier and fast. Whereas in other environments, we see that there is also here much more fluidity, much more flexibility to actually think about what do we want to accomplish, and then to find and develop a joint solution to actually serve the need of patients. And there are countries which enable that, which clearly also finally find the benefit. So in oncology, and I'm giving this example, we have molecules which have different indications. So it's the same molecule, but you can today use it for, or it had been approved for melanoma, and the next day it's in breast cancer, and the third day it's somewhere else. But it comes in different times. And every time you come with a new kind of indication, you need to go through the full process of reimbursement, which takes, of course, many, many months or even years. And with this, although you had already discussed some economic grounds on this molecule, you still need to go through the same process. And during that time, imagine many, many patients might have created a benefit from this product if they could have gotten it. So we had an example in Belgium where we were able to think about a long-term solution to bring all of these different indications under one roof. And with this, we created a massive impact in terms of patients, how they could use it. So instead of 6,000 patient lives impacted, we were able to have 11,000 patients having a positive impact on their lives. So this is the difference you can make through flexible processes, through innovation, through also, of course, discussion, coming to the table, trying to find solution in a partnership. And I think that's very important.
And Martin, what are some of the lessons about transformation that we can draw from COVID?
Right. So let's say the person has a type 2 diabetes, body mass index greater than 35, hypertension, he drinks, smokes, doesn't move, so his likelihood of actually, once getting a COVID, having a very serious case, actually dying is a multiples of 10. Right, and actually, the same applies to every other civilization disease to some extent, actually to great extent. And the lesson learned is that we saw this on our own eyes on a daily basis. And in order to make the leap we need to make sure that people who actually are staying healthy, are trying to improve their health, are to some extent benefited, because it is, I know that in most of our healthcare system, we are based on a solidarity, but where is the solidarity in the fact that somebody is actually looking after his health and the rest are not, because we saw how, what the health outcomes of the ones who are not looking after are, how much they cost and everything. So in order to make all these transformations, I think we need to start with the people. And I know this is not very popular. I know this is something that politicians always love to tell, that they want to either increase premiums for the ones who don't behave well or motivate them to get better. But it never actually implements or never is put in practice. But I think this needs to be done. It is very unpopular, but if we don't change the way people behave, we can get into the market whatever innovation, whatever new product, it will never be enough. And if you look into how all these risk factors and risk behaviors have changed since, let's say, 2000, in most countries it is still stable, but the levels are way too high. And for example, in Slovakia, it is estimated actually by OECD that 48% of all deaths can be attributed to risk factors, which could have been prevented if us as a population would be motivated to get better, to behave in a different way. And in order to do this, we need to change the way how premiums are calculated, how prevention mechanisms are organized, and make sure that we as individuals, as inhabitants of the countries, feel responsible for our well-being.
Mm-hmm. Well, Francesca, he invoked some OECD research. Are there other things that we know about how we can wield policy to encourage healthier behavior?
Yes, I mean, healthier behavior is obviously the results of many different things. Some of them are within the health sector, some of them are outside of the health sector. So the whole notion that we hear about, you know, a whole of a society, you know, approach to health, addressing the social determinants, clearly, you know, doing things also in school, in the education systems, are quite fundamental for prevention. I mean, the type of approaches that you can use can be both addressed to the individual itself, or they can be more addressed to the broader population. So if you have things like making sure that you have good communication campaigns about healthy behavior that are addressed to the entire population, but you can also, if you think about a person who is obese, have some counseling in primary healthcare, which is more directly targeted to the individual affected as well. And you can have a mix of more intrusive, if you want, or more you know, stronger interventions using regulatory mechanism, using also, you know, pricing and fiscal policies, or you can have things which are more trying to nudge individuals into behavior through education, through trying to change their perception and so forth. And all of that are important. I mean, the analysis that we have done on the economics of preventions at the OECD has shown how to really address those risk factors and unhealthy behavior, you need a package. The most cost-effective way of addressing it is through a package, which includes a mix of all those interventions, some of them more targeted to individuals, some of them more targeted to the population as a whole, some of them that use nudging, and some of them which are a little bit more compelling through the use of fiscal or regulatory policies.
Thank you. And Joanna, we've been talking about kind of how to drive individuals, but what about healthcare workers? How, you know, what are we learning about how we can help train them to really maximize their impact on the system?
Yeah, thank you for the question. I think one of the big lessons, again, that has been underlined during the pandemic has really been the essential role of healthcare workers in making a difference and allowing them the space to innovate, but also provide support to them. So again, I think what we have seen in a lot of partner countries where we have been supporting the response to COVID is really that the type of support available to healthcare workers has made a huge difference. And I think healthcare workers really can become big champions. So Francesca already mentioned the primary healthcare interventions that can be targeted at individuals if you think about the prevention of non-communicable diseases. There, again, healthcare workers are big champions, can be big champions that make a huge difference in those types of interventions. And I think that, and I think this is the sort of thing where we need to support healthcare workers to become these types of champions. Again, they cannot do this on their own. I think it's very important to recognize approach. You need the different levers within a healthcare system. So you also need to be able to have the regulation. You need to be able to regulate, especially when you talk about addressing non-communicable diseases. That is an essential part that you can address the systemic factors that drive these things. But I think healthcare workers really are at the forefront of both addressing the communicable disease pandemics as well as the pandemics of non-communicable diseases. And as such, I think are essential if we are thinking again about this theme of resilient health systems, of transforming health systems for the future. To me, they're a very essential building block and one that we mustn't forget.
Thank you. And before I go on, are there any questions in the room for now? Not yet. Feel free to just raise your hand at any point, and I'll take note of it. Oh, all right. Well, thank you. Please join us at the microphone here. Just word to the wise: if you wait for the last 5 minutes to ask your question, we might not get to it. So,
good morning.
Thank you.
I'm coming from a biomedical research area, and I clearly see a connection between sustainable supportive research and excellent research performance with the status or quality of the healthcare system. So do you think that another lesson to be learned from this pandemic is the role of research and supporting the role of research to improve healthcare systems?
Thank you for that. Francesca, do you want to start with the relationship between research and healthcare systems and
sure, and I think it's as was mentioned in these questions, again, this pandemic, what we're seeing, it's a huge role in research, in the quick R&D and development at a speed that was completely unexpected and unthinkable of new vaccine in really less than one year. And that would have not been possible without having had the research and development being done beforehand. So, the new platform mRNA is the results of years of work that was done before that. So there was a huge investment that was done beforehand in understanding also what was the experience with previous coronavirus, investigations that were made in the past that were helpful then to make sure that vaccine R&D did not start from zero, but could build on something, build on something which already was known, building on new technology platform, building on extensive knowledge also from previous vaccine, and all of that really made clear, accelerated the process of development vaccine itself. So I think there is a clear role for ensuring that we have research and strong investment in research. There is probably a need also to understand and making sure that we direct the research to highest priority needs for regulators. And that has to do also with things that sometimes might be neglected, with areas where there is perhaps less investments. The minister mentioned mental health, for example. We still have very little by way of innovations in mental health, for example. So there are definitely areas in which there is a role also for governments to make sure that we create a different mechanism for, prioritizing areas of research.
Thank you. Gabriella, what role should government be playing in research, and how can we drive more focus on areas that have been neglected and maybe are not very easily commercially viable?
Yeah, so I think also here, what we have seen now in the pandemic and the development of the vaccines is partnerships. So partnerships are really helping. Partnerships are driving us, speeding up. And when you mention now areas where we need more research and where it seems from a commercial point of view not that, let's say, attractive, it's antimicrobial resistance is the area where we see that there is a big need of new antibiotics, which are actually still effective in an environment where we see increasing resistance. Our company is investing a lot there, although it's an area which is not very attractive, but still there is a great commitment and moving things forward and actually providing the benefit to patients. But I think these kind of initiatives would require a kind of a collaboration. It could be partnerships. It could be a different type of a consortium or whatever could be funded around these. And then I think one of the results, which we see now with all the COVID vaccination, is a result which could be actually kind of copied and pasted for other areas as well. So I think there is a big chance, but we need to speak to each other. We need to discuss what are the objectives, what are the needs, and then we will find solutions together.
Thank you, Johanna. Especially dealing with parts of the world where some of the diseases that affect them tend to be neglected, or as we're actually seeing with COVID now, the global North is getting access to the vaccines much more quickly than the global South. What do you see as potential solutions as far as research and then also having access to those innovations?
Okay, so I think you touched on two very important things there. So first of all, we definitely need the basic research, and we need to work on a system where we can have, where we can speed up the equal access to the fruits of that research, to the outcomes of that research. And COVAX, I think, is a good example for that. We need further support for COVAX, thinking about COVID. But there's a big area of research that we haven't mentioned here so far, and that's operations research. So operational research, understanding how health systems work and how to make health systems more effective and efficient. So what types of policies, what types of financing arrangement work, for example, in addressing antimicrobial resistance. So I don't have to develop a new antibiotic. That's, that's of course the golden end point, but there are other things we can do. We can innovate within our health system. And I think operations research that looks at how policies can be designed to support interventions, to ensure that primary prevention works at primary healthcare level, to ensure that we can use, for example, when we think about nudging of behaviors and NCDs, what are the technical interventions that work there? Are there certain things on an app, on a mobile phone, mobile telephony, using mobile telephony for health insurance purposes? All of these are aspects which we need operations research alongside the actual intervention. So for me, research is absolutely vital. It's been shown, the importance of that has been shown by the really breathtaking speed of innovation that we have seen during the pandemic, that is helping us now to address the pandemic much more effectively. The vaccine that was discussed, obviously, both the result of breathtaking speed, but the sustained long-term investment and research of those scientists. But alongside that, also for me, the other side is understanding what types of interventions we can do to best protect our healthcare workers, to best protect our populations. What are the policies that incentivize? A lot of the stuff around prevention in the healthcare system must not cost a lot of money necessarily. It doesn't require a new drug necessarily. And I think for me, evidence and research also there has a very, very big role to play. And I think, again, we have seen this. And I think we see this in the differential experiences that countries have had, that even within countries, different groups of populations have had in our healthcare systems when we look at the health outcomes that they have, be it non-communicable diseases or be it for COVID.
Thank you. The really great points. So we have about 12 minutes left. So in just a second, I'm going to ask the floor for if you have more questions. But first, let's take a peek at the results of our poll, which again was about the most urgent health challenge for systems over the next 3 years. So yeah, okay. People are very concerned about the idea that people haven't been getting the care that they need for chronic diseases, things like cancer, mental health, also very high up on there. Interesting that preparing for the next pandemic and antimicrobial resistance, which could well end up being related to each other. Interesting in this room that that's not a big factor. Kara, how would you two answer? Martin, what would your answer be to that poll?
Yeah, probably the same, the backlog of chronic diseases, because we did some preliminary calculations based on the decline in number of diagnostics procedures undertaken in the last quarter of last year. And when we extrapolate in the future, we've calculated that for every single day of, let's say, decreased production or decreased number of tests undertaken, 90 to 120 undetected cases would happen, right? So every day we would lose 90 to 120 of cancer cases that otherwise would have been detected. And out of these 90 to 120, roughly 30 to 40% would be in the stage 1 to 2 cancer, which means more or less treatable stage. So for me, for sure, the backlog of chronic diseases and the diagnostics would be on the first place.
Gabriella,
yeah, for me as well. I mean, the first point is really the urgency. It might be not the importance on a long term, on a strategic perspective, but it's really the most urgent piece. So now, in order to avoid more harm versus what we have already created with the pandemic and of course the disruption in regular therapy, we need to act fast and get patients back in treatment.
Mm-hmm. Yeah, indeed, I did put that 3-year time frame on it. Francesca, which would you choose in that poll?
Well, I think the first and the second can be even brought together because there is clearly a backlog also in addressing mental health issues. But it's quite clear that, as we move into the pandemic and once we have had the immediate acute phase, there is issues about what would be the longer term consequences. So, the chronic conditions, which is not really just the cancer care, but also people with cardiovascular disease, for example, which also have a backlog of care, and even in terms of preventions in maintaining also continuity of care, mental health, as I mentioned, even elective surgery. There's been data really starting to show up about delays in elective surgery, that while they may not be life-threatening, they do make a huge difference to the quality of life. And the questions really is how to make health systems which are both able to very quickly surge capacity and react in very agile way to an emergency that has come up, that obviously we hope can be, if not prevented, at least reduce the initial impact through better preparedness for emergency. That will be fundamental. But how can we make those two things coexist? Ability to surge capacity and to manage an unexpected emergency on the one hand, with maintaining the continuity of care for all patients.
Thank you. And Johanna, your response to the poll. I don't know if you're able to, if you were able to see it, I can, or if you're still with us. All right. Well, I'll see if there are any questions on the floor for now. No? Okay, we'll move on. So preparing for the next pandemic, not seen as necessarily super urgent over the next 3 years by this group, but I'm curious, and Martin, I'll start with you. How would you rate our preparedness for the next pandemic at this point? Are we going to be starting from scratch, or have we set up some good systems?
Well, it depends. What do you mean by us, and what do you mean by next pandemics?
Fair enough. Well, okay, fair enough. Well, that's the problem. We don't know what the next pandemic is going to be, right? Or else we could start making the vaccine now. But another infectious disease. People have said maybe we were lucky with COVID because it didn't really affect children. Most people get. But if there's an even worse pandemic or a pandemic flu, as many had predicted, will governments in Europe handle the next one better?
Well, it all depends on what's going to happen with the lessons learned, if they are going to actually put in practice or just ignore them or have just some nice conferences and discuss them for hours and do actually nothing. Because, well, let's say that, because that always happens, I see that plenty of you have attended such conferences or workshops, and the conclusion was that yes, let's do something, but it has actually never happened. Well, but let's say that most of countries had a first wave, then a summer break, second wave, and now it's going to be slightly better, and then we're likely to have third wave. And just when you ask yourself what actually change between the first and the second wave. In some countries, yes, they prepared for the second wave. They've created more resilient systems, supported diagnostics procedures, etc. But in many countries, they haven't done anything yet. Slovakia, Czech Republic, for example, is a nice example of that. And from that perspective, I'm afraid that there always will be some countries, unless they are forced by EU Commission or another authority to change, that they will just claim that yes, we are going to change it, yes, we are going to prepare, but eventually they won't do it. And if you have one country which has higher incidence than others, it will always spread to neighboring countries, then to the surrounding countries, and then you will have wave coming from the west to the east, from the north to the south. So from my perspective, if one country in the EU doesn't do the job, all will suffer. And I'm afraid that unless, as I said, EU doesn't step in, we won't be prepared for another pandemics.
Mm-hmm. Gabriele, has anything changed within the pharma industry to prepare for the next pandemic?
I think what is always important, and that goes for our industry as well, is to learn from these events, and then to clearly have conclusions, learnings, and then to act on it. And that is also valid for government, for everything in life. I mean, for every individual. Once we have experienced the crisis, we learn from it, but then we can only become stronger if we act on what we have learned on. And I think if we are not able to put reforms into place when we have seen that there is an issue and a lack of resilience in our healthcare systems, and even if we increased it now over the pandemic, I think it's not enough to actually stand strong in the potential next pandemic to come. If we don't change things, if we don't apply the learnings, we will be in the same position again. Yeah.
I mean, I'm sorry to put you on the spot, but is there a particular change that you can point to that's happened over the past year within MSD that you can say is a result of lessons learned?
Yeah, I think there is many lessons learned, and there is a clear kind of understanding on how important research is, how important is also risk taking in research for us as a company, because I mean our model is a high risk model in all of the investment in research, but it really kind of showed how important it is to take this risk and to take even maybe the higher risk, because the messenger RNA vaccinations, which are now proving very well, seem to be even, and it's a much newer technology than some of the vector vaccinations and immunizations. So the risk was higher with messenger RNA vaccines, but it proved that this was the good thing to do.
Mm. And we should have Johanna back, and I'm glad that she will be able to weigh in on this question. I asked to what extent we can be confident that changes, or if we can observe already that changes as a result of this pandemic are preparing us for the next pandemic, or does it still seem to be business as usual in your view?
I think we're seeing real change. I think the importance of, as somebody who works in global health, I think the importance of health and health systems and our preparedness has been recognized by everybody on the street and by the decision makers at the highest level. So I do think it is now about the point of translating that into concrete actions. And I think that's where I see our community and us collectively here in this room and beyond as having a certain responsibility. So we need to make those changes happen. I think there are real changes afoot. A really important point about the importance of partnership. What this pandemic, I think, has shown above everything else, not just about the importance of science and evidence, but I think about the importance of partnership, right? So we can only do this together. And I think this is the spirit that we have use as a catalyst, or have to catalyze to strengthen, I think, further strengthen the existing political institutions, the multilateral system, the scientific community, the scientific system, and then to see where are there aspects beyond that. So the pandemic treaty, which will be discussed in a special session at the World Health Assembly this autumn, is one such instrument. Is already assigned. The G7 discussed extensively. The leaders, the highest leaders of the G7 governments, did discuss health extensively, unlike ever before. And I think it's now about a host of us, in a way, making these commitments and making sure that these commitments are turned into a new normal and to a reality where we're much more aware and preparing much better for the next pandemic, because not only do we have the chronic diseases that we know will continue, I think unfortunately we are also so aware that antimicrobial resistance is a real threat, and we know there will be other and further pandemics. So I think this message must not get lost, but I certainly have a real sense of optimism that we can learn and galvanize this energy now.
Great. Well, thank you, Johanna. So we have less than a minute left. I'm going to ask one question from the Slido that I think is a cool question, but we'll need a very quick response. Most public health intervention is focused on changing the behavior of the populations rather than the governments or regulators. How can we improve? Martin noted pressure from Brussels as one way. I only have time to let one of the rest of you answer. Anybody want to take that on? Francesca, Johanna, Gabriela.
Yeah, I think no. I mean, it's the issues of changing population behavior, individual behavior, is one part of the equation. But there is obviously an important role of governments, and making sure that this is addressed more at collective level, so a collective population level. And I think the two must come together, because for some individuals also, making the good healthy choices is not necessarily the easier choice to make, or it's not necessarily the cheaper also choice to make. So there are obviously things that governments need to do to make sure that those healthy choice here becomes the easier choice for individuals. So there is really a need for both. It's changing individual behavior on the one hand, but also facilitating that change through government interventions.
All right. Well, on that note, we'll wrap up. Thanks to you, Francesca and Johanna, for joining us online. Martin, Gabriela, thanks for being here in person. Likewise to our audience, thanks for being here in person and online. And for those of you who are here in person, coming up next in the Habsburg Room, where we are at 10:35, we have a session called Strategic Autonomy versus Global Supply: How to Secure Value Chains. Also definitely a factor in this health discussion. And during the break in this room, we'll be live streaming what's happening on the Maria Theresia stage with a session called Towards the EU That Delivers. And that'll have state secretaries of the foreign affairs ministers from France and Slovakia. So lots of good choices. Thanks, everybody.
Thank you.